After a diagnosis of asthma is made, the physician will give their advice on treatment. In adults that don't have a lot of symptomology, they may just let them know to identify and try and avoid those triggers. If their trigger is exercising when it's cold, they may just advise them to not exercise when it's cold. If it's cigarette smoke, they may just avoid smoking and avoid being around the tobacco in the air. If it's a child, they may let the guardians or the children know to avoid their triggers, or if it's an adult patient where they can't avoid their triggers or they must be around them, or if it's just a severe part of the disease, an inhaler is definitely a very common medication or a prescription or a form of treatment that you might see for asthma. There are different types of inhalers and different types of that treatment that we'll cover here in a second. Nebulizer treatment is very common in primary care offices when this diagnosis is being made. Also, if a patient is experiencing an asthmatic attack or they're having problems with their airway, a nebulizer treatment can help. It's a bronchodilator. It acts to open up that airway to help them in their case of need. Really, to prevent this, it's really just minimizing exposures, and that's both in diagnosed asthmatics and non-diagnosed asthmatics. It's really just about the less exposure to these long-term triggers like extra cigarette smoke, extra unclean air, pollutants, etc. The more you can minimize that exposure, the less likely someone is going to be suffering from asthma. Prescriptions, common prescriptions. Asthmatic patients need a controlled medication, a medication that they take every single day. It's a glucocorticosteroid that helps them avoid asthmatic attacks in the future. It will do nothing to help an asthmatic attack in progress, but it's a preventative thing that must be taken. Examples of this are Qvar and fluticasone. There are also medications prescribed called a rescue inhaler that should be kept on them at all times, and in the event of an asthmatic attack that can't be helped, or that can't be helped with just slowing down breathing or avoiding that trigger, in the event of the attack, a bronchodilator is needed where it opens up that airway and lets air in the case of an emergency. Albuterol is the generic name. Brand names are ProAir and Ventolin. How are MAs applying this? You're asking good questions. If they come in talking about difficulty with the airway, difficulty breathing, you're going to ask them about all these things. Ask them about their history. Ask them how often this has occurred. Ask them if there are any triggers that this happened during a specific time. How long has this been going on? Are there acute or chronic incidences of this occurring? You're going to get a good oxygen level. Even if the physician hasn't asked for it yet, you're going to go get the pulse oximetry level and go check it. And then you're going to take an accurate pulmonary function test, whether that's peak flows or spirometry. You'll do that, and then make sure that you're following up with the patient, make sure that you get a good pharmacy, make sure they know how to use their medications, etc.